hope you had a chance to stretch a little bit in between these sessions. Get ready for the next one. I'm going to give it just about a minute. All right. So welcome, everyone. This is really exciting. I'm so glad that we're able to do this and to see so many people. People that honestly I haven't seen for a while. So it's nice. The other side of that is the last year I have honestly been able to meet many more people from across the entire state because we've been doing this virtually. So there's a couple different ways to look at it. So it's really nice. I'm glad we have this opportunity. So I am Barb Sorum. I am the Director of Prevention Initiatives for Family-Wise Services. My region is Southern Minnesota. So all of Southern Minnesota, I think there's 38 counties. And I've had a chance to talk to so many of you already this morning. So that's been really kind of cool. I'm office in Freeborn County, so I actually live in Albert Lea. My office is in Albert Lea, so this is where I am coming from. So I'd like to take the opportunity as we gather our collaborative coordinators, take the opportunity to acknowledge, I think we all want to acknowledge and are so grateful for all the hard work you're all doing and have been doing to support children, families, and communities in general. And especially over this past year or 14 months during a particularly stressful election season, civil unrest, and COVID-19. You are inspiring leaders. You're inspiring leaders for all of us. And we're grateful to partner with you and learn from you as we roll out more resilient Minnesota across the state. So thank you very much. What we're going to, just a quick snapshot of what we're going to be doing for the next 45 minutes. We're going to be doing some introductions. We'll review some of the key themes and learnings that emerged from the 7 collaborative regional discussions that we just did. Hi, Debbie, good to see you. We're going to announce a new tool that collaborative coordinators can use to connect with each other and share resources. So that's going to be really fun to share. It's been a while in the making. We're going to provide an overview of the More Resilient Minnesota. And we're going to hear from collaborative coordinators who have started implementing their community resilience initiatives as part of phase 4 in the initiative piece. We'll have time before the closing for question Q&A about the initiative, and then we'll wrap up. So with that, I'm not sure who I'm turning it over to.
I can take it. So we're going to ask you to introduce yourselves. So if you could, and we're going to have you do it in the chat because we have quite a few people in our group. It would take us a while to get through, but in the chat, if you could share your name, what region you're from, the county or collaborative you represent, and the length of time that you've been in your collaborative coordinator role. And Emily put what those questions are that we're asking you to respond to in the chat, but I will also repeat them. Share your name, what region you are from, the county or collaborative you represent, and the length of time you've been a collaborative coordinator. And that way we can all just watch them as they roll in too, so we can, so we don't have to sit and talk through them all either. So Perfect. Thanks. I see them starting to roll in now. Awesome. Thank you. No worries. Welcome to the collaborative coordinator group, Karen. That was a lot of cuz. Thanks for joining us. 3 months. Awesome. And now I think I am turning it over to Lindsay.
Thanks, Jenna. So we just came out of our last session where we spent time within regions having discussions around all of the great work that's happening. And we want to take a moment to hear from all of you. What were the key themes and takeaways from your discussions? What did you learn that surprised you? I know it was absolutely wonderful for me to sit and listen to all of the good work happening across the North Central and Northeastern region, Region 1. It was so great to see a lot of familiar faces and a lot of new faces as well. And it felt really wonderful to be reconnecting after a roller coaster of a year. So would anybody be willing to share any aha moments you might have had listening to the good work happening across your region?
Hi, this is Janelle Shulman. I think my aha moment is kind of like it's a validation that every collaborative is so different, and some are really in the weeds of service delivery, and some are really in the weeds of policy analysis, connection, systems development. So it's really hard to compare. I find myself comparing myself to other collaboratives, but everyone is so different based on our partnerships, who pays our salaries, all of those kind of things. But it was good to hear how different we are from each other, but we're all still working on the same goals, right? Making sure families are connected to resources and they have access to information out there in their own communities.
Thank you, Janelle. I really appreciate that. I think, speaking as a staff support person that has been kind of looking at the project too, I think that has been a realization that we've come to as staff too, how, very different collaboratives work in community. And honestly, that really comes down to what this work is really all about. There isn't any cookie cutter solution that's going to work for all of us because our communities are so different. And so really the work that we do and really being responsive to community and having different ways of navigating and joining sectors, I think that was really highlighted for me as well over the course of doing this work. Thank you. Other thoughts?
I think the pandemic gave people the opportunity to sort of erase some of the boundaries between services and agencies and resources and come to the table. And so they really created their own little resiliency committees out of need. And I think if you had tried to do that outside of the pandemic, it would have taken a lot more work and heavy lifting. And now if we can just keep that energy going forward, that helping each other and coming together to solve problems and that collective responsibility was a nice, benefit, if I can attach that word to the COVID.
Yeah,
I'd like to share.
Go ahead.
I'd like to share a concern that I have. I've been involved with the collaborative for 8 years in Bemidji. Is my voice coming through okay? Okay.
Yeah.
And a persistent problem that is just getting worse in our area is a workforce issue for mental health providers. And I'm very concerned with the pandemic and all of the mental health concerns that will probably be unveiled as kids come back to school in a normal fashion in the fall, that we will not be able to keep up with the need in our communities, and the lack of focus on drawing more people into this field and adequately compensating them. It has me deeply concerned. It's also shifted my focus as a coordinator away from trying to, I feel like it's a systemic issue and it's very difficult to deal with it as a local collaborative. And it's something that we need to pay attention to as a state. And it's very concerning to me, and I guess I don't have a solution for it, but I just want to draw attention to that. Thanks.
I would echo what Wendy said. Hi, neighbor Wendy. I was in 2 conversations, and really we have too seen such a focus on our teaching staff, the adults in the community that, you know, are supposed to be modeling SEL type of things in classrooms that themselves are struggling. We don't have the capacity for our summer school, and we have a huge school engagement issue, as everyone does, I'm sure, but we just have teachers that need a break. And so I think we are hoping to refocus some efforts this fall with really providing adult SEL. So I'll be calling peacemakers because I think, you know, as Stacy said, if the adults that are in front of the kids are not modeling that kind of resiliency, we're gonna see it come on the other end. And we too have a very big shortage of mental health supports up here.
Yeah, thank you, Wendy and Kim. I think it's so important, and to raise it right now in this group, right? Because again, you are all the movers and the shakers, and we so appreciate just the experience and the wealth of knowledge and resources, and that pulse point you have on your communities. It's important, and I think being aware of that and raising that issue right now is really crucial.
I have a question for some of the rural counties when they're looking at attracting professionals or even keeping professionals in their community. Is there kind of I'm just thinking about myself. I come from a rural area, right? I'm in the Twin Cities. A lot of my friends came from rural areas or in the Twin Cities, and there's no desire to go back. And part of that is because many of us have children who are biracial or multicultural, and sometimes it's really scary to go back to those communities, especially in the last 5 years. And I was wondering if there's any ever discussion about why people don't come back after they get higher education to their rural communities. It's just kind of a curiosity perspective for myself, you know?
Yeah, thank you, Janelle. I think, you know, that ongoing work of creating brave spaces in rural communities to have the types of conversations we need to have is a work in progress. I think the more that we raise those types of questions and put our minds together, I think, you know, that's all part of the work and the process. So thank you for posing that thought.
This is Jamie in Clearwater County, and I can just speak for my little rural county here.
Yeah.
We have about 8,000 people in our county. And you know what, we have had conversations with mental health providers, substance use disorder providers, and transportation providers. And our issue has always been, I think what you're talking about is just that comfortability of people coming back. I think that's definitely a real thing. But also we have a need, but our need isn't great enough to support these providers to be able to financially make it in our community. We don't have enough people that make it financially worth them coming to our community and staying. And even, you know, we're only 25 miles from Bemidji, which is kind of our hub up here where we get a lot of the providers to come from. But even those providers to 25 miles, it's not worth their time financially to drive 25 miles over here when they potentially get here and they have clients that are no-showing them. They don't get paid that drive time. You know, so I think there's some issues around the reimbursement for providers as well. So I think that's one of the biggest things I've noticed.
Thanks for that. I think, yeah, we've built a system where everything has to be reimbursed through insurance or MA. And that's one of our downfalls of our access, right?
Yeah, thank you. Such great thoughts being shared. I also noticed Colleen added a link in the chat that I want to draw your attention to. That might be of use. All right. Well, thank you all for your thoughtfulness and really thinking about the wealth of information we just heard from our communities regionally. We want to take a moment to transition, and I'm going to pass things on over to Jenna.
Thanks, Lindsay, and thanks everyone for sharing and being here today. This is, where we start, so I'm really appreciative of it. So we have a really exciting announcement. We have created a platform where collaborative coordinators can come together to share promising practices, strategies, etc. It will be called the Collaborative Coordinator Slack channel. Some of you may be familiar with Slack. It's a platform that can be used for a multiple variety of uses, and we are using it to support collaboration and communication among you all, among Children's Mental Health and Family Services collaborative coordinators. It is intended to be a place where collaborative coordinators can create community to help them grow in their roles and enrich their efforts with their collaboratives, communities, and the More Resilient Minnesota Project. This is a place where you can share promising practices, resources, and strategies. You can ask questions, find information, celebrate successes, and announce exciting news. You can also coordinate activities and events across regions and welcome new collaborative coordinators. We're hoping it's a place that you all can access from time to time to connect at a really conversational level, just so you'll be able to really easily connect and have access to a place where you can pose questions, resources, and then get responses back. So I am going to share my screen really quick so I can show you all what it would look like. So when you, and we'll talk about how you're going to be invited to this in just a moment, but this is what it will look like. And as you can see, Emily here has pinned our purpose statement, which you also can find. If you go over here and show channel details, you'll be able to see more information about the channel, but you can just leave it like this. Down here is where you can message and basically pose your questions, pose your comments, and ask for responses. And then if you see on the left-hand side, you see this is where your channels will be. So you'll also have options to join a couple of public channels as well, such as a Slack help channel or other things like that. And then you'll also be able to connect with people directly if you have a private conversation you wish to share. So this is a free platform, and we will be offering some trainings in the upcoming months to help you all get familiar with the platform. And we do understand that this is, that learning a new platform and a new system can be challenging. And to incentivize participation, we will be offering weekly drawings for 2 collaborative coordinators for the first month to encourage involvement. So on Monday, you will all be sent an email from us. And if you don't get the email, you can check your unfocused or your junk folder, and that's where it might be found. But if you don't see the invite even in there, let us know and we'll resend it to you. And then, like I was saying, there's going to be some not contests, but participation incentives. We'll have some prompts for you to answer to or to post to, but at the end of each week, whoever has participated in the prompt or in the response will have their name put in a drawing, and then at the end of the week we will pull names to see who wins and announce it via the Slack channel the next week. So please feel free to use this really great tool. I see some people in the chat talking about it a little bit. It can seem overwhelming, like to learn a new platform, but it is fairly easy to learn, and I like to think it's very user friendly, which is why we chose this platform additionally. So Yeah, are there any questions about it at this time?
Are you kind of beta testing it, meaning that you're going to see how it works? And then I always hate, like, I think I'm overwhelmed with platforms right now. Like, there's
Yeah.
platforms I have to use for the school district, have platforms for the county, platforms for all these different collaboratives. And I worry about, here's another platform that I'm going to be honest, I'm probably going to neglect. And
Right.
I'm like, I want to use it, but I'm like, I would like to see us, like, when's the point where you decide that we continue with this platform or we don't continue it, or if it's working really great or it's not working really great?
Yep, that's a really great question. And that is exactly what we're doing. This is a pilot-like program, and we're hoping that you all can pilot it. And we're doing this incentive promotion for about a month, and that's kind of to see if having some incentives, if people start using it, if it'll kind of take on its own life after we get people to start using it. There are notification settings that you can connect to existing platforms as already, like your Outlook. So you don't always have to be checking this new platform. You can get the notifications sent to your email or your Gmail or something like that too. So Slack does, like I said, we chose the most user-friendly one because, and that's another something that we've come across, that we don't want to add another platform. We get that and as collaborative coordinators, you all have so many rods in the fire already that we understand adding another thing can be feel overwhelming, but that's why we wanted to do this incentive program, and we chose Slack to try to make it more streamlined into what most of you are probably already using. So that's a good question, Janelle. Thank you.
So Jenna, I just want to say that if those have been around for 15 or so years, we used to have a email platform where everybody could share with everybody else. And that was pretty cumbersome, and it was run through another agency. And when they changed people, it went away. But it was really a good opportunity for collaborative people just to say, hey, we're going to try to start a XYZ. Has anybody else done it? What are the pitfalls? So you never have to feel like you're starting new with anything. You can always just throw something out and say, anybody else got any advice for me as we're starting this out or as we're transitioning? And so I think if you look at it like that, it's a real informal way just to get some quick feedback on what you're doing. And that's what the old one was. So I think this will be good if people that want to use it. I mean, I think it's a really good opportunity to just be able to use that for a hey there instead of going through other means.
Yeah, thanks. And that's kind of what we're hoping, is that it can just be a really simple, easy way for you to connect on things like that. You know, maybe if you're looking for a presentation opportunity or presenters, co-presenters, something like that, where it can just really quickly send a message and get a response back. Yeah, any other questions? Thanks, Edie.
I might just add that our hope, so again, you know, if this isn't going to be something that takes off, we're not going to push it. And again, like sometimes thinking about how to minimize all the emails that fly back and forth, like this could be an opportunity to streamline communication and get information you want. You really are the driver. So once you opt in, you can decide, you know what, I don't want any notifications, or I only want notifications, you know, in a specific type of setting. So you really can figure out how much you want to engage. And as Jenna keeps saying, like, we are trying to drive users because we know that if we slowly roll it out, we will probably have crickets, nobody will use it, and then, you know, what's the point? So the hope is to really kind of start strong, have some kind of fun prompts that you can come and join and share about every week. For the first month, we'll do a survey and just say, like, okay, how's this thing working? What do you need to see? Do we need more apps like to add so you can like join a Zoom meeting right away? So we're learning with you, and the hope is that we, you know, what we learned from this pilot, because we've heard from collaborative coordinators over the years that like this is something that would be valuable, maybe not in a Slack platform, but just like a way to convene and share resources. So this is kind of what we've, after doing some research over the last couple of years, like this feels like something that we're ready to try. And we don't know how it'll go. So we want to hear from you candid feedback on like, how is it going after a month and ongoing, and what adjustments can we make midstream? The only other thing I wanted to note is that our hope is to expand this more broadly to our presenter network, our tribal community partners as well. So there could be affinity groups within the channel. So it would be, you know, collaborative coordinators have a private channel that's only open to collaborative coordinators. There'd also be affinity groups for trauma responsive schools, for example, and people who really want to share resources within that within that topic area. So the idea is we will continue to build this out, but we didn't want to do everything at once because that felt like a big undertaking. So we're starting with this group who we know will give us some honest feedback as we go, and we'll continue to kind of build as we go. So that's kind of where we're at now.
Thanks, Emily. Any other questions? All right, sending it back over to you, Lindsay. Thanks, everyone.
Thanks, Jenna. All right, so to recap, we wanted to do just a very brief overview, reminding everyone regarding our More Resilient Minnesota initiative. As you see in the chat, we come from a wide range of, being in this work for decades to 3 months, I think was one that I saw in terms of a very new collaborative coordinator coming on board. So we just wanted to do a brief overview, reminding everyone regarding the More Resilient Minnesota work, the phases that we move through, as well as just reviewing the region map, and so on and so forth. So I think if we want to put those slides back up, that would be great. Thank you. All right, so you see on the screen here our More Resilient Minnesota map by collaborative phases with the counties. It is definitely the end of the day, so I apologize, I'm tripping over my words here, but what we really wanted to do was to give everybody a good idea regarding what phase communities in your region are at regarding the project. You can see again, it's color coded. We know that there are still some regions, collaborative communities that have not opted in. We would encourage you as champions of this work already, if you have a relationship with any of the neighboring collaborative coordinators who maybe haven't opted in yet, we appreciate the help too as regional staff in making some of those connections and finding some of those inroads. I think hearing from colleagues, so if hearing from you regarding your experiences with this project, I think also is a good way to tell the story and to encourage other folks to join this good work. As you can see, we have collaboratives in all different stages moving through this work. We want to point out that let me see here, that really this work is intended to build capacity within your communities, so this work can continue long beyond our involvement. We really want to be true to that way of doing this work, especially because it empowers community members to be leaders in the self-healing communities movement. So keeping that in mind, we also wanted to show you the regional staff that support each region. And our contact information can be found there as well. If you're new coming into this work, we encourage you to reach out if you have been at it for a long time, but maybe you haven't been as able to connect because you've been busy with everything else on your plate lately. We really encourage you to reach out, and we'd love to renew some of those connections as well. Finally, we wanted to show you and celebrate all of the good work that we have accomplished from the beginning of this project on. We showed this infographic at the beginning of our time together, but we did want to highlight it again. We know that there are so many more ripples of this work and stories maybe not represented here, but what we did want to do is take time to celebrate all of the good work that has been going on. When you think about the scope of it, reaching nearly 14,000 people across the state of Minnesota with the shared language, shared knowledge, shared understanding around near sciences, knowing that we've engaged over 600 people in community conversations, really being true to hearing those voices in the community, and then adjusting our work, our mission, the way that we support our communities as a result. This is important work, this is meaningful work, and we really do need to take the time to acknowledge and celebrate all of the progress that we've made collectively. We also want to acknowledge that as a family-wise staff, as your more resilient Minnesota support people, we too are learning as we go. Like many of you, we've learned a lot over the past year, and we've adapted our work to meet the needs of the communities we partner with. We're doing our best to include clarifying documentation through this process. And we do want to remind you that updates are posted to our web page as a place for you to go to find more information regarding the project documents, the wealth of information and knowledge that we've collected over our time together. We want to name one of those adaptations that has been made this year with great results, expanding phase 3, the community conversation piece, and adapting to what communities needed, where we added in the option for doing the 100 cups of coffee as an alternate way of hearing from voices in your community who maybe aren't generally around the table. We thank Beltrami and the other areas across the state of Minnesota that have been doing that great work and really piloting that process. We've learned a lot from all of you, and we continue to share those lessons. We also want to note that we have piloted the very first round of our Community Resilience Initiative micro grants. And we do have the collaborative coordinators who received those grants here with us today, and we'll be hearing from them shortly. Kim Geislinger from Itasca did have to step out, but she gave me her update in case there's time for that. So with that, I'll pass it on over to Emily to continue.
Oh, okay, so it sounds like Lindsay, you have the update from Kim. So I might pass it back to you in just a moment. So thank you. And I know, okay, so I just wanted to share briefly, as Lindsay was saying, that the we're moving in through phase 4, and phase 4 through More Resilient Minnesota is really comprised of 2 kind of complementary activities. One is working on developing the community resilience plan that is informed by the conversations and what you learn through the phase 3 process. So the, phase 1, I'll back up for a moment. The phase 1 is really sharing neuroscience information within your communities. When we talk about neuroscience, we're referring to neurobiology, epigenetics, and historical trauma information, the adverse childhood experiences study findings, and resilience research. And so the trajectory of this initiative starts with just broadening awareness about neuroscience as widely as possible across many different community groups and sectors, training presenters locally to continue to share and spread that information. And then through phase 3, we are focused on supporting community conversation and hearing from community voices about what matters most to community members. And then the phase 4 part that we'll be highlighting now is really focused on taking what you've learned through that first 3 phases and really kind of focusing that on developing a community resilience plan and potentially outlining a community resilience initiative or initiatives through that process. And so now, as Lindsay mentioned, we are in that 4th phase where we're starting to pilot that 4th phase. And so we are going to showcase the 4 communities that currently are implementing community resilience initiatives that are funded by DHS. They're microgrant initiatives. And so I wanted to make sure to kind of highlight the 4 collaborative coordinators who are planning to share. And I know that Lindsay's sharing on behalf of Itasca, but I wasn't sure if anyone else needed to step out early and if we wanted to start with anyone in particular or just we'll start with Lindsay and Itasca's update. I'll just pause for a moment. Okay, so maybe Lindsay, if you're up for it, we'll start with Itasca's update.
Yeah, so Kim Geislinger shares with me, as you can see there on the screen, there's kind of a summary of the work they've been doing. Kim says it really falls into 2 main buckets. She says they've developed a trauma-informed classroom tool to provide for shared language in our schools, and it will be a pre-tool work. It will be what they use prior to the workshop that they're developing and hoping to offer as part of their all district day this fall. She also shares that the other piece of the work is mini grants to teachers to support resiliency in their classrooms. So teachers in their school district were able to apply for a small bucket of funds to be able to meet the needs directly in their classroom to support resiliency. She said they were very popular, and it's something that they plan to make as an annual thing that they offer. So they're seeking funding from other sources to be able to continue to offer those supports to teachers who are doing this good work in their classrooms. And often, as we know, educators often spend a lot of money out of their own pockets to provide those additional tools and resources to use with their kids. So being able to build capacity and ensure sustainability for this work by encouraging looking for other funding streams to be able to continue to provide that annually. So those are the updates from Kim.
Emily had asked that I go next. I'm Wendy Thompson from Beltrami Area Service Collaborative. We used our DHS mini grant to bring on 2 consultants to help us make a splash with the results with our 100 cups of coffee interviews and our results from that. So they have been very helpful in setting up a Facebook page and a website, and we have a logo, which is a chickadee. A chickadee is very resilient, and I've learned that chickadees also take in other species when they have needs. So that's kind of the image that we want, is to be nurturing in our community. So we had a community resilience conversation, and from that, we decided that certain folks were always missing, unrepresented at our table. And so that's why we decided to do the 100 cups of coffee. And we had connections in the community that gave us warm handoffs to people who they believed had ideas and insights and wisdom that we needed to talk to. And we had volunteers trained to go out and interview them, a set of 13 questions. And then we had an evaluator put together what we learned from those 100 conversations. We just finished, we didn't really finish, but we say this is our first set of cups of coffee and one-on-one conversations, but our resiliency team grew to about 80 people. Not that all attend everything, but they're all in the know about what's happening. And we went out and shared our information with a lot of different traditional leadership tables, but then we also continued the conversation with virtual meetings. So we set up a space where people would feel comfortable joining us, and then we do breakout rooms, and we keep track of all the ideas that are coming in on the very same questions we asked our intentional 100 cups of coffee participants. And we're now moving into that next phase of taking what we learned and creating a space where people will come together to bring ideas that came out of 100 cups of coffee to fruition, and continue to do the warm handoff of who's not here, how can we do the outreach to them, how can we build what we have. But it's a very subtle, I think, peacemakers, because there's a very subtle thing but very powerful thing happening about how we come together that's different than our traditional meeting setting. So I'm learning so much. And the relationships that are developing are really heartwarming, and there's a lot of storytelling, and there's a lot to be learned here. We have 20% of our population in our county is Native American, and so there's a lot of healing that needs to happen here. So thanks.
Thank you, Wendy, for sharing. I'm curious if Melody, if you're open to sharing about Robbinsdale and the work that you've been doing in partnership with your community.
Hi, everyone. Yeah, so our 100 Cups revealed some themes around the need to have a centralized kind of depository or site where everyone could go to find information. And so we did that, but we put it on the district website, which then wasn't always easy to find. So we're in the process of launching a more resilient Robbinsdale with permission of plagiarizing More Resilient Minnesota. We have that website that will be launched the end of this month. And that'll be a location where people can just go to find local resources, where they can connect, where they can volunteer their time, where they can just learn more about the great things that are happening and the need that is happening in our community. The other thing that we heard was that we are a predominantly BIPOC community, yet we don't have those very open, honest conversations. So we've started some of those in a more meaningful, deliberate way. And we just had one 2 weeks ago on equity in education called the epidemic within the pandemic and the increased mental health for our BIPOC families. And had really some good information shared from some of our experts around the increase in the ACE scores for our BIPOC families since the original ACE study. And so that was interesting in a learning tool. And our mini grant also focuses on just kind of the need that was identified to come together for conversations, but also a youth leadership and evaluating our cultural competency in all of our programming. So we had to postpone it till tonight because the pandemic actually impacted printing. Who knew that paper would be a shortage? But we have a community reads book by a local African-American author around bullying, which 51% of our students identified being bullied on the Minnesota Student Survey. So we're having that conversation tonight in the hopes that that will continue to add supportive resiliency and growth within our community and a sense of belonging. We also have a group of youth that are being hired as our interns, student interns, and they're being groomed to be our community builders and our youth advocacy for changing the way services are delivered to youth. And so that's exciting. They're very energetic and keep me on my toes and us on our toes. And I think the fact that we had this wonderful opportunity for the neuroscience training to be not only conducted in our community, but that our superintendent embraced it. And FamilyWise was gracious enough to modify the training to meet the needs of the vision and goals of the district that tied to teaching and equity. And that was so impactful that when we just went through the last 6 weeks of tragedy, multiple tragedies, our leadership said, this is why it's important for us to know what our babies go through before they walk in our doors every day. And I think that the impact of this work and the training and the neuroscience, training over almost 1,500 people in that neuroscience made an impact in how we were resilient and could immediately bring together healing circles throughout our tragedies. So thank you to everyone for that. And it was interesting to pull this together in a short period of time with who knew paper shortage and things like that. But we look forward to continuing this work and having our youth lead us through this. Thank you.
Thank you so much, Melody, for sharing. And I know we're at 1 o'clock. I'm curious if Diane, if you're able to, for those of you who might be able to stick around just for another 3 to 4 minutes of the gift of your time, if you're interested in sticking around just to move towards closing, we'd love to have you stick with us.
I was going to say mine is really short and not that in depth. We did the community conversations, and one of the main things that came out of them was that even families and our providers, even though we're a small county, didn't know what resources were available. And so we determined that we were going to do a webpage with our county resources on, and we wanted to connect it to some place that wasn't tied, like we didn't want to do the school and we didn't want to do the county. And we did the Morris Chamber because it is now called Morris Area Chamber, which encompasses all of Stevens County. And so we partnered with them so that we could have a semi-communication hub for the counties that providers, first of all, would know about, and we will make sure that they are trained or made aware of this resource to then hopefully engage families as well. And so we did that so that it would be friendly, not tied to like the county or the school where families may have negative thoughts or have had bad experiences or whatever. We wanted it to be friendly. And so then also they're even though we are paying to get it developed, they will maintain it, which is kind of nice too. So that is a plus for us. And then another thing that we wanted is in the past 10 years, our population of Hispanics has grown from probably 3% to 25%. And so we wanted it to be bilingual. And so we really looked for someone who is going to be developing and inputting this data to be bilingual. And it took us a while, but we found an individual who has that capacity. She's bilingual and articulate and good. And we now will be moving forward to inputting the data onto the webpage that we had designed. We actually used some of the grant to have that designed professionally. We did Cybersprout and had them develop the webpage so that it would be friendly and eye appealing. And now this, our person will input that bilingually into the thing, and hopefully by the end of June we will have it up and going, and we will have county resources available for all families that can be built upon. And that's all I have. So yay.
I was just wondering if some of the people who shared who do have the website links to share with us as a group would be able to put that in the chat so that we would be able to look and see what you guys have created.
We don't have an active link yet, but when it is, certainly we'll share it with family-wise, of course, and they can share it with everybody.
Or you can put it on the Slack channel, Diane.
Yeah, you're talking to someone who's, you know, I'll try that, but at 63, I'm learning. I mean, Zoom has been I've learned Zoom, you know, I'm getting there, but my technology skills are, but I can try. I can have someone help me with that.
Go for those prizes. That's the motivation, right?
There you go.
Oh, our time is just so short, it seems like. Any other questions or thoughts you can just absolutely put in the chat. I just want to thank you all again. I know we're a little bit over. Thank you all for joining us during this time. And we're all learning so much from each other. It's just really exciting. So please reach out to your regional staff person. Emily put the links in the chat, but she can put them in again. Reach out to your regional staff person to learn more and visit our More Resilient Minnesota webpage. You can find the links in the chat. So remember, I did just drop in, we're doing another presenter training in August. So if you're interested in that, let us know. Also tomorrow, we're going to start with 2 rounds of breakout sessions in the morning, followed by a mindfulness, I almost said mindless, mindfulness grounding activity. And what we're all looking forward to, from 1 to 2:30 tomorrow, we'll wrap up the gathering with our keynote, Dr. Diaz. Okay, the author of the Cherry Blossom Study. And thought leader in the field of epigenetics. So thank you all again. One word checkout and just put them in the chat. What are you leaving here today with? One word checkout. And thank you very much. Have a great rest of the day, and we'll see you tomorrow morning. And will our team be sticking around if there's additional? Not very long, maybe.